welcome to MedRise. Today we're going to be talking about Mallory-Weiss and Boerhaave Syndrome. So those are two ones that get easily mixed up, but we'll solve this through the ultimate vomit battle. All right, so these two conditions sound similar but have wildly different implications for your patient's survival and to score big on step 2 CK. So if you hear the word hematemesis after vomiting, think Mallory-Weiss. If you hear chest pain and crepitus after vomiting, think Boerhaave. One stops the bleeding and the other one can kill you if you blink. But don't worry, by the end of today's episode, you'll never miss this question again. So let's build the foundation first. Mallory-Weiss tear is a mucosal tear at the gastroesophageal junction. It's not full thickness. And Boerhaave syndrome, that's full thickness rupture, a catastrophic hole right through the esophageal wall. So to put them side by side, we're going to go over what causes both of them. Both are caused by forceful vomiting. Bleeding, well, you're going to see that in Mallory-Weiss. You're going to see bright red hematemesis. Boerhaave, usually not so much initially with the bleeding. Mallory-Weiss, you're going to see mild chest discomfort, whereas Boerhaave, you're going to see severe chest pain. Shock, rare with Mallory-Weiss, but common with Boerhaave. For subcutaneous air, not so much in Mallory-Weiss, but you're going to hear crepitus in Boerhaave's. So the first test for each one of them. Let's start with Mallory-Weiss. You're going to do an endoscopy, an EGD for Mallory-Weiss, and you're going to do a chest x-ray or a gastrograph and esophagram for Boerhaave's. Treatment is going to be supportive or endoscopic clips for Mallory-Weiss and emergent surgery for Boerhaave's. So that was, we're going to do a mental flowchart to help you get through this. So, vomiting episode. Is there hematemesis? Yes. Are the vitals stable? Yes. Then it's Mallory-Weiss. If the patient has chest pain after the vomiting, yes, then you're going to do You're going to think of Boerhaave syndrome. You're going to hear the crepitus, subcutaneous emphysema, and that confirms your diagnosis. Simple rules. Blood points you towards Mallory-Weiss, and the pain and crepitus scream Boerhaave. So how do they trick you on the exam? So vomiting, then hematemesis. What is your diagnosis? Mallory-Weiss. Severe chest pain after vomiting? Boerhaave. Crepitus on palpation, Boerhaave. Hematemesis, stable vitals, Mallory-Weiss. Hypotension, dyspnea after vomiting, Boerhaave. Hammond's crunch, Boerhaave. If you spot vomiting followed by severe chest pain or subcutaneous emphysema, then immediately think Boerhaave. It's a time-sensitive emergency. So, let's run through a quick vignette style example. 32-year-old man vomits after a drinking binge. He feels mild chest discomfort and vomits red blood. Blood pressure, normal. Diagnosis? Mallory-Weiss. It's a mild chest discomfort and vomiting red blood. Next up, a 45-year-old man vomits violently, then develops sudden chest pain radiating to the back. You find crepitus all over his chest wall. Chest x-ray shows pneumomediastinum. Diagnosis? Boerhaave syndrome. Do you see this difference? Yeah. All right. Now we're going to do it one more time. Patient vomits blood after drinking heavily. Mild chest pain, vitals are normal. What is it? Mallory-Weiss, because the hematemesis and stable vitals. Severe chest pain, crepitus after vomiting. First step, chest x-ray. Never do endoscopy first in Boerhaave, imaging first to find the leak. So if you hear the crepitus, there's chest pain and vomiting, chest x-ray so you can visualize it. Left-sided pleural effusion plus mediastinal air. Diagnosis, Boerhaave. Mediastinal crunch synchronized with heartbeat. What is that called? Hammond sign. What is the best test to diagnose Mallory-Weiss? Upper GI endoscopy, EGD. Alrighty. So if the question focuses on vomiting blood, think Mallory-Weiss. If the question focuses on chest pain and respiratory distress, think Boerhaave's. Boerhaave's is a surgical emergency. Mallory-Weiss is usually self-limiting but may need endoscopy. And always prioritize imaging first if you suspect esophageal perforation, not the endoscopy. Remember, the esophagus may tear superficially or may blow wide open, so recognizing which one instantly can save your patient's life and your score. And if you found this helpful, be sure to subscribe and leave a review, and we'll tackle the next set of differentials in the next episode. Thank you.